Hello all, I am Dr. Satyanarayan from VS Hospital, Chennai. I am a physician and diabetologist. Today I am going to talk about hypertension. Hypertension is a very common word, otherwise called as high blood pressure, which you all know that it's a very common medical condition to the present days. It is patients with hypertension usually come with some few symptoms. Some of them will be complaining of lightheadedness. They may complain of a headache, mostly complain of the back side of the headache, or early morning headaches they may come, or easily fatigued, or they may come up and say that they are having a difficulty breathing. Even for a shorter distance, they are finding a difficulty breathing, or they may find a mild chest discomfort, or when you walk, they find the chest discomfort is there. So these are the very common symptoms of sometimes they may be even excessive dizziness, or sometimes they may have a fainting episode, or they may have a blurring of vision. There are different symptoms in the patients with the hypertension. So if you have any of these symptoms, or if you are having a family history of hypertension, even diabetic, it is always better to check your blood pressure frequently, so that if at all if there is a slightly higher blood sugar levels are there, or blood pressure levels are higher side, you can always treat it accordingly. So there are different stages of hypertension. So first is called the normal stage of blood pressure. Sometimes it's called as the blood pressures are measured in two values. The upper value is called as systolic blood pressure. The lower value is called as a diastolic blood pressure. The upper value should be around 120 on 10 to 120 millimeters of mercury. The lower value should be around 80 millimeters. That is a normal value. Those who have a pre-hypertension, suppose anyone with a pre-hypertension of upper values are around 120 to 120 and lower values around 80 to 84, these are called pre-hypertensive levels. So another one is called as next stage. Next stage, any blood pressure values above 140. The systolic, and the lower values above 90 is called as stage 1 hypertension, or they are on the in hypertension. So the above that, some of the blood pressure readings goes more than 180 systolic, lower level going more than 100 and 110. That means the blood pressures are quite higher side. So these are the minimum. These are the different values, the different stages of hypertension. So do not ignore your blood pressure. Don't think that it will come down on its own. I am having a stress today, that's why my blood pressures are on the higher side. So keep checking your blood pressure frequently. If these readings are above normal, it is advisable to go and see your family physician and take your medications regularly. Please keep this in mind. Blood pressure is not like fever. Just you took it for 5 days or 10 days, it goes up. You have to take it for quite some time. So take your medications regularly to prevent complications. Thank you.
VS Hospitals. Care, cure and compassion.